Hi all, it's Dr. Ruth Dutton here. I'm a board-certified adult psychiatrist who uses metabolic and lifestyle interventions to get at the root causes of mental illness. Now today we're going to be talking about insulin resistance and specifically 3 non-dietary strategies to reverse insulin resistance. Of course, diet is going to be the single most important strategy, and I've done a whole other video going into detail about different dietary strategies that you can use. I'll put that linked in the description below. A quick summary is that you can change what carbohydrates you eat, when you eat, and how much carbohydrate you eat. But let's move on past diet because there's actually a lot of other important factors that can influence your insulin sensitivity and your blood glucose levels, which of course, as we've discussed before, contribute to metabolic dysfunction and mental health symptoms. That's why I, as a metabolic psychiatrist, care about this. So we're going to talk about 3 of them here. This isn't an exhaustive list, but these are 3 of the most important. And that's going to include 1, sleep, 2, stress management, and 3, exercise. So let's dive into sleep first. We know that poor sleep can lead to insulin resistance. In fact, just 5 days of sleep deprivation in an otherwise healthy individual can lead to full-blown prediabetes. And this is likely mediated by the release of stress hormones like cortisol and norepinephrine, as well as increased inflammation, which we can see as evidenced by increased inflammatory markers like C-reactive protein and serum amyloid A. When these processes occur, your blood sugar increases and your insulin sensitivity decreases. So we recommend getting at least 7 hours of sleep per night, and some people may need up to 8 or 9 in order to achieve optimal health. Now, how do you get better sleep? Of course, I'll put in a few sleep hygiene tips here. 1, you can go to sleep and wake up at the same time every day. 2, avoid naps during the day. 3, avoid caffeine anytime after noon. 4, avoid screens, all screens for the hour before bed. And I recommend implementing a nightly wind down routine for that hour before bed. Maybe it involves some mindfulness activities or time spent with loved ones, but this hour should not involve screens. Also, try not to eat for about the 3 hours before you go to bed because this is going to disrupt your natural circadian rhythms because we're not meant to eat when the sun goes down. We're supposed to be signaling to our body that this is time to rest and digest. Not only that, but you're more insulin sensitive in the morning as opposed to the evening. So you could eat a meal with the same amount of carbohydrate in the morning versus in the evening, and you'll have a different response in terms of your insulin sensitivity and your blood glucose levels. What about if you do shift work or work overnights? Well, we know that there is an increased risk of both mental health conditions like anxiety, depression, as well as medical conditions, including cardiovascular health, diabetes, obesity, and even some cancers. So if it's at all possible, I would recommend trying to avoid overnight work. Of course, I understand that someone has to do the overnight work. It's not always going to be possible for you. So you may want to consider sticking to one schedule. So rather than flipping back and forth between nights and days, trying to just regulate and adapt to just sticking to overnights or sticking to days. It may also be helpful to use a natural supplement like melatonin to help regulate your circadian rhythms and help trigger your body to thinking that it's time to go to sleep when it's actually daytime. If none of these interventions are effective for improving your sleep and it's really a problem for you, then I would definitely recommend speaking with your medical and or mental health provider to talk about other potential resources that may be helpful for you. Okay, so the next step is going to be stress management. And again, this is going to be mediated by those same hormones, cortisol and norepinephrine, which are going to increase your blood glucose levels, decrease insulin sensitivity. And for many, it's also going to cause an increase in cravings for sugary and high carbohydrate foods, which is only going to perpetuate the issue. So yes, chronic stress can lead to insulin resistance. So this means that we need to find healthy ways to manage our stress, whether it's engaging in mindfulness practices like yoga, meditation, guided imagery, adult coloring, engaging in individual therapy, taking psychiatric medications, maintaining healthy relationships with others, or having other ways of managing your stress. We also have to think about this in terms of hermetic stress, which is stress that is healthy for you, right? A little bit is good, but of course, if you have too much, it's going to be detrimental to your health. So think about this like exercise or intermittent fasting. Both of these things are fabulous for you in the right dosages, and they can be great for reversing insulin resistance as well. But at the same time, it's important that you're not overstressing your body with these hormetic stresses by overtraining without giving your body adequate rest time, by constantly engaging in intense fasting regimens without any breaks or variety. It's important to get enough rest, and to switch these things up so that your body can continue to benefit from these interventions. And that brings us to the last non-dietary intervention, which is going to be exercise. Exercise is amazing for insulin resistance. It helps to sensitize your cells by bringing those glucose transporters to the cell membrane so they can soak up all of that glucose from your bloodstream and use it for energy. Just a couple of minutes of exercise, squats, anything really, can activate this response. So if you're doing this maybe once every 30 to 60 minutes throughout the day, you could be in an insulin sensitive state all day long. Not only that, but muscles are basically like glucose sponges. So the more muscle mass you have, which we get by resistance and weight training, the greater the glucose load you'll be able to absorb and utilize for energy, rather than just storing for fat. Now, what's the best kind of exercise? Well, pretty much any kind of exercise can stimulate this response, but we generally recommend a combination of both high intensity interval training and resistance or strength training to build more lean muscle mass. Now, there is plenty of evidence to show that zone 2 training, which is moderate level training, think going on a brisk walk or hiking, where you can still talk in full conversations, but you're not really able to sing comfortably. We know that this is also really beneficial for glucose control. It's just maybe not as time efficient. But really, whatever exercise you enjoy and that is realistic for you to implement in a regular and sustainable way is what you should go for. Okay, so I hope this was helpful. Of course, if you're doing these things, but you're eating a whole pizza and a pint of ice cream every night for dinner, it's not necessarily going to undo that, because diet is still really important, but they're certainly going to help, especially in conjunction with dietary changes. If you have any questions, please feel free to put them in the comments below. And if you enjoyed this video, please hit the like button and subscribe for more metabolic and lifestyle psychiatry content.